Welcome to Ageless and Outrageous, your favorite podcast about how to age amazingly. I'm urogynecologist and hormone and sexual health expert, Dr. Kristen Jackson. Every week, I share my over 25 years experience to guide both men and women as they age. Listen as I discuss a variety of topics, including hormone optimization, pelvic floor health, maintaining a vibrant sex life, weight gain issues, and skin, hair, and body changes as we age. It's happening to all of us, so listen for some solid scientific knowledge on how to handle these changes. Tune in for a dose of laughter, knowledge, and an honest perspective on the incredible adventure of growing older. Today's podcast episode is really a fun one. I know I try to use this time talking to you to teach you and educate you and make sure you understand changes that are happening in your body and how to make yourself age amazingly. But today I'm going to talk about something that is, at least in my mind, fun, interesting, and I'm going to talk about the history of vaginal pessaries. Now, in my office, I use a ton of vaginal pessaries as a non-surgical treatment option for pelvic organ prolapse. I think our patients really love the fact that they have a non-surgical option if they're feeling pressure or a bulge or a ball coming out of the vagina. It's a great option for patients who are older and maybe don't want to take a risk of surgery. It's also good for patients who have prolapse, but they're not done having their entire family, so they're going to get pregnant again. And finally, I use pessaries for people who may want a surgery at some point, but they just don't have time right now to go through the surgery and recovery. So they might use a pessary for a couple of years until they've retired or until their grandkids are older and they're not babysitting them anymore, and now they can focus on a surgical repair. So most of the time, when I see patients and tell them that there's a non-surgical option for their prolapse, many are so incredibly relieved because they usually start the visit thinking that surgery is an only option for them. Now, I know every time I talk about pessaries, I always like to throw a little bit of history in there. So the word pessary comes from a Greek word pesos, meaning an oval stone used in a game like checkers. But the recorded history of pessaries starts all the way back in the year 1550 BC. This is the first time we ever have documentation of a prolapse and how to address it. There's a document called the Ebers Papyrus, which is named for George Ebers, who happened to purchase it in the 1800s. This document contained 5 pages of ancient gynecology and the remedies to allow the womb of a woman to slip back in place. They reported applying honey and petroleum to your fingers and to the uterus, and then pressing on it to return it back into position. So basically, replacing the prolapse back into the vagina. So even in BC times, we know that there are documented reports of uteruses falling out, and people knew they needed to go back in. The next report for a treatment of prolapse came in the 5th century BC. This is when a treatment called Succussion is used, which involves, believe it or not, suspending a woman upside down, like tying a rope around her feet and hanging her upside down, and then aggressively shaking her up and down to try to get the organs to go back in the vagina. And some reports also talk about a cupping mechanism on the buttocks and lower abdomen, like they thought the suction would pull the prolapse back up into place. And then, closer to 300 BC, there are reports of using hot oil stimulants. So in this process, a woman is laid on her back and a pillow or something is put under her pelvis to lift it up. Then the prolapse is covered in hot oil and pressure is used to push the prolapse back in. If they were successful, then they would take a big plug of wool, like a ball of wool, and put it in the vagina to keep the prolapse in place. Of course, they'd have to take the wool out every couple of days and change it. But I can only imagine how it would feel if you are a woman with prolapse to have hot oil being poured over your prolapse. I'm not sure if it was scalding oil where they would get blisters of the vagina or if it was just warmed oil, but it was something to make the prolapse slippery so it could slide back inside. Probably the most common thing other than wool used to keep the prolapse inside is fruit. And the most common fruit reported in history is pomegranates. They loved using pomegranates in the vagina to hold up prolapse. I don't know whether it's just that the shape of the pomegranate kind of fits inside the vagina well, or is the pomegranate firm enough that it holds the prolapse inside, but there are many reports of pomegranates being used to hold prolapse inside. The only thing that worries me about putting a pomegranate inside the vagina is, how do you grip it to get it back out? The pomegranate doesn't have a handle on it. And once it's inside, you'd really have to get your whole hand in there to try to pull it back out. So I don't know if they were the best option, but there are a lot of historical reports about pomegranates. So next up, I want to talk about the Greek physician Soranus. Soranus is reported to be one of the most learned and critical and lucid medical thinkers of antiquity. He had a work called On Midwifery and the Diseases of Women that includes descriptions of contraceptive measures, an OB delivery chair, and how to deliver a baby if they're coming out feet first, which is a breech delivery. He's also credited with coming up with a method to assess the health of a newborn that really is like our APGAR scores that we use today. So, not surprisingly, he also had something to say about prolapse. His belief was that the prolapsed uterus had animal-like characteristics and that disagreeable odors would cause the prolapse to revert into place. So he would make women stand over something that he was burning that would make fumes with bad smells, hoping to scare the uterus back up into the vagina. So even though he had a lot of good ideas, things that eventually developed into our APGAR score and breech births, I don't know about standing over disagreeable odors to scare the prolapse back into place. So by 25 BC, we have another Roman writer named Celsus, and he wrote a book called De Medicina, which is considered one of the finest medical classic texts. He described a bronze cone-shaped pessary with perforations in the metal. And through those perforations, you could put bands of fabric in that would tie around the patient. So you'd put the bronze cone in the vagina to hold the prolapse up, and the bands of fabric would come out of the vagina and you could tie it around your waist to keep it in place. And actually, a bronze pessary of this type was found in the ruins of Pompeii, so we know that these things actually existed. And this bronze type pessary is probably one of the first types of pessaries in history that I find to be kind of reasonable. Bronze is not porous, so it wouldn't harbor any bacteria. The cone shape makes sense. That's kind of the shape of the vagina. And obviously, using the ties was just so that the bronze wouldn't slip right back out. So overall, that's not that bad of an idea to help women hold their prolapse inside. And Celsus also recommended cleanliness, and he would actually urge in his book that wounds would be washed and treated with substances that we now know to be considered antiseptic, like vinegar and thyme oil. He also described some plastic surgery of the face using parts from other parts of the body, almost like he's describing an early skin graft. He wrote about tying off arterial bleeding using little ties or ligatures like suture. And he also listed the 4 cardinal signs of inflammation that all medical students should know: heat, pain, redness, and swelling. So you can really see the basis of a lot of modern medicine in his writing. So let's move on from BC times into AD times. And here we can look at the Middle Ages, say between the years 600 and 1000 AD. Now we have Paulus Agena, and he's credited as a brilliant surgeon and is sometimes even called the first male midwife. He was the first to operate on tonsils, but I will tell you that he described this technique of scraping the mucous membrane of the tonsil with one finger and then scooping it out with a forceps, pulling it out. So I'm not exactly sure about that technique, but he did describe an early tonsillectomy. And he was also one of the first pioneers to actually cut open the abdominal wall. And the reason he was able to do this is that he was aware of the importance of antiseptic technique. So he knew he had to keep that wound clean. He would use boiled rainwater or salt water to sterilize the abdominal wall before making an incision on it. And then he also described a lot of methods to control pain during an operation. He used mandrake, which is known to contain scopolamine, and a product called Morus alba and Hedera, and they're both known sedatives. So he was actually using natural substances to give a patient pain relief and sedation so that he could perform a surgery on them. Now, you may still not want to be that patient. I don't know how good the pain relief was, but at least it's better than just doing a surgery with nothing. He also reported on 3 types of pessaries, but they weren't physical pessaries. They were really just different products that you would put on a ball of wool and it would go inside the vagina. So we do see pessary use even in the Middle Ages. Then by 1050 AD, we have someone considered to be the first female gynecologist, Jonas Platerious. And she used strips of linen that were rolled up into a ball and placed inside the vagina. And then she would keep that ball in using like a T-shaped binder that went between your legs and up over your hips to hold it in. So here you can actually see a little bit of progress being made. They're still trying to hold the prolapses in. They're trying to do it in a more safe and comfortable way. But by now we've reached the 16th century. And it was in 1507 when there was the first ever case of a transvaginal hysterectomy being performed. So if you're squeamish, you're going to get ready to mute here for a few seconds because you may not want to hear this story. So the uterus is falling out. What they could do is tighten a piece of rope around the topmost portion of the prolapsing uterus. Then they would leave it there until the uterus just became gangrenous and died, and eventually it would fall off. So really what they were hoping to do is seal off all the blood vessels to the uterus with a big piece of rope. The uterus would then die and necrose and fall off. And believe it or not, if the rope was tight enough, patients have actually been reported to survive this horrifying type of procedure. I mean, I can't even imagine the smell of the uterus as it is becoming gangrenous and dying before it actually fell off. So these women had to be tough to deal with their prolapse, tough to deal with tying off their uterus and hoping that it would die and fall away. And then in the 17th century, things get even crazier. In 1603, there are reports of attacking the prolapse with a piece of red-hot iron, like a poker, thinking, again, you could poke it and frighten it back up into the vagina. But when we move ahead to 1663, I actually found some reports of some more reasonable actions happening. So one physician at this time wrote a report that he had to remove a wax ball that was being used as a pessary because it was preventing the normal vaginal secretions from passing out, which we now know that if pessaries are too occlusive, they can do that. So he decided to replace it with a pessary made of cork with holes in it to allow the secretions to come out. And of course, today, now we have pessaries specifically designed with openings and spaces to allow the vaginal secretions to pass. So using cork, using something that had holes in it actually does make sense. And then I came upon another story from the 1600s. This is also not for the faint of heart, but it's about a woman named Faith Howard. And she had prolapse and she was out working in her fields and she lifted something heavy and the prolapse just all of a sudden got a lot worse. Like she felt it fall all the way down and out. She was so angry and so frustrated with this prolapse that she actually grabbed her own uterus that was falling out and pulled until she pulled it off completely. I cannot even imagine this. The bleeding she must have had when she ripped off the uterine vessels must have been huge. And imagine healing from that. I mean, that is so outside the norm of what we do today. I can't imagine the massive fistula, which is opening, between the vagina and the bowels that she must have had after the surgery. But we do know that Faith Howard survived this procedure because there were reports of her living well beyond when this procedure occurred. So it's pretty crazy that that even happened. But when you're really at your wit's end, I guess there's nothing else to do but yank off your prolapse. Please don't do that today. Please come see me or another urogynecologist. We have much better options for you. So finally, we move into the 18th century and we actually get some writings about soft rubber pessaries that are being used so that the soft rubber will not irritate or harm the vaginal walls. And it wasn't until the 19th century that finally we start to see terms like cystocele, rectocele, and enterocele being used. Plus, in the 19th century, we had the advent of good surgical technique, and we had the ability to give anesthesia, and we had antibiotics that we can use at the time of surgery. So in the 19th century, not only do we have some pessaries available, but we really see a lot of surgery to correct prolapse coming on board. Rather than putting something in to hold it up, we're actually trying to do something to fix it. Finally, in the 20th century, it's actually the 1950s to be exact, polystyrene replaced the hard rubber pessaries. And today we actually use silicone pessaries, which is really the best option because it's non-absorbent, it's resistant to bacteria, and it's hypoallergenic, so it can be used in all patients. So definitely some fun stories about pessaries and what women through the ages have had to endure with their prolapse and had to endure being done to them with misinformation, because when we don't know, we can only use the best information we have at our time. And of course, I certainly hope 100 years from now, we have even better and easier and safer techniques to help women either deal with prolapse or maybe even prevent it in the first place. I will tell you, I've been doing urogynecology and prolapse surgeries for 20 plus years, and I really don't know how to prevent prolapse if women are going to continue to have babies, because having a baby is really the most damaging thing you can do to your pelvic floor. So I don't know that we're going to have a lot of good preventative options, but we may have better and better options to actually treat it. But I hope you enjoyed today's fun walk through history. And I certainly love medical history, and I'll continue to share that with you. So this was definitely a fun look back at all the things we used to put in women's vaginas to help hold their prolapse back up. Thanks so much for listening to today's episode. No information from this recording is intended as a diagnosis or treatment for any disease. If you are enjoying the show, please subscribe so you don't miss any of our exciting episodes. And we love to hear from our listeners and would be grateful for your positive review. We'll talk next time.